Let's talk today about what to do prior to your injections and what to expect after your injections. So this is obviously a question I get a lot. People want to know, what do I need to do to give myself the best outcome and what do I need to do afterwards to also give myself the best outcome. I'm Dr. Danny Clark, Director of Orthobiologics here at the Protea Performance Center. So prior to your injections, there's a few things that are kind of a non-negotiable. Depending on your individual case, we might adjust this a little bit, but the main things is that we don't want patients to be taking powerful anti-inflammatories prior to their procedures. This is for a couple reasons. Is Anti-inflammatories affect platelet quality and platelet activity. And the purpose here is that they're not releasing some of their inflammatory signals. And so that's what helps control inflammation. That's why they're anti-inflammatories partially. And then there's also a blood thinning effect that can happen with some anti-inflammatories like aspirin, again, affecting how platelets behave. And we use those platelets to help stimulate a healing response. And so we want those platelets to be functioning as well as possible prior to your injections. We also don't want our patients drinking alcohol for, I like to say minimum 72 hours, but really the longer we can go before and after without alcohol is going to improve the overall response. Alcohol is essentially a toxin that affects our whole body and can make things function in a way that we don't want them to. It also increases our bleeding risk prior to procedure as well. So that's the other important reason why we make that recommendation. But really, it's about making sure that you're kind of at your healthiest by the time we draw that blood or take that bone marrow. And so that when we do those injections, those cells are functioning as well as they possibly can.